Vertebral column consists of 33 bones, and in between each of them we have intervertebral disc, which is working like a cushion. Now, if we were to partition each part of the vertebral column, then I could tell you that we have the first segments consist of 7 vertebrae, and that's called cervical vertebrae. The second section consists of 12 vertebrae and is called thoracic vertebrae. The third section is lumbar vertebrae, which is handling the most of our body's weight, and is about and it consists of 5 vertebrae. And the last part is sacrum and coccyx. Both together they are about 5 fused vertebrae, and now we call them sacrum. Alright, what are the main or important part of a vertebrae? Now here we're talking about a typical vertebrae. Now, each typical vertebrae consists of a body, so is in the center, and now we are looking at from above. So this is superior view of this vertebrae. We have the spinous process, which is located in the posterior, and even you can feel it on your own if you touch the C7, C6, that these two parts of your cervical vertebrae is palpable, and if you put your hand you can feel that part, and that's the spinous process. Now we have also transverse processes on both sides, and this whole part of the vertebrae is called vertebral arc. And the vertebral arc, it has two main parts, that is in fact connecting transverse process to the posterior or the spinous process is called lamina, and another part which is connecting the body to the transverse process is called pedicle. We have also superior articular process, and there is also inferior articular process, but you cannot see that because we are having the superior view of the vertebrae. So in fact, superior articular process is articulating with inferior articular process of the superior vertebrae. We also have a vertebral foramen, and the spinal cord is running through this foramen. Alright, let's talk about clinical relevance of that. So earlier I told you about intervertebral disc, and if there is a huge amount of pressure on intervertebral disc, then we'll have herniation of intervertebral disc. Now, the intervertebral disc consists of 2 parts. The inner portion is called nucleus pulposus, and the outer portion is called annulus fibrosus. Now, when there is a rupture to annulus fibrosus, this nucleus pulposus can get out. Now, if there is this rupture, for example, here in this part of the intervertebral disc, then this nucleus pulposus will push the nerve roots or the spinal cord, and that causes the occurrence of symptoms of this herniation. Alright, let's do some more quizzes. So here you can see a clinical relevance of the topic you're studying. Identify A and B. Identify indicated structure. So here you can see a photo CT scan of a vertebrae. What do you think a number 1 can be? Now, number 1 is the spinal cord, and 2 is the herniation of the intervertebral disc. I told you the inner portion is nucleus pulposus, and annulus fibrosus is the outer portion of the intervertebral disc. And this herniation, they are putting pressure on the spinal cord. Now, I think I've named all these structures here. Which region of the vertebral column is imaged in these radiographs? Identify the indicated structures. Alright, so here you can see the lumbar vertebrae, and what we can see, number 2 is the spinous process and the body. So number 3 here is in between 2 vertebrae. Here you can see the intervertebral disc. Number 4 is indicating body of the vertebrae. Number 2 is indicating the spinous process of the vertebrae. And number 1 is probably showing the transverse process or pedicle